now a nexus of conflict, of crisis, of COVID, of economic crises around the world. So it's very simplistic to try and make it about hesitancy. It is much more multifaceted and much more multi-layered than that.
They have been trusted. Tanzania is among the countries that has been doing very well in vaccination and in terms of coverage. So issue of trust is there. The thing that came up with issues of myths and misconception, as you're giving the example. So there are a lot of myths and misconceptions that came out. Healthcare workers did not have much knowledge so that they can also communicate the very same knowledge to the community. And that's where the hesitancy that came in.
There's an opportunity. We all have an opportunity now. We all have a duty to bring these numbers up. And we have the global community here now in the UN to call upon and make them act. Everybody has a part to play. The journalists have a part to play. We all have a part to play to bring these numbers up.
The organization to be flexible, to come to the ground to discuss with us the approach that that can work in our setting, because we know the people that we live with, we know what they believe in. So in that way, maybe we can be able to get a lot of people vaccinated.
So if you work with marginalized communities, sometimes we have vaccines available, but they might be available at facilities. But when persons with disability try to access vaccination, then these facilities might not be really designed for individuals with disability to go in.
Because we have a lot of recovery that we need to address in this space around immunization and making sure that we're not only catching up all of the kids that we know have been lost as a result of the pandemic in terms of coverage, but recognizing that reaching those marginalized communities, those really hard to reach populations, we need new solutions, we need new opportunities. We've learned a lot. Let's not lose that. Let's not get into that terrible cycle of sort of panic and then neglect as we move forward.
In COVID-19, we learned the really bitter lesson that the vaccination has to happen at a time and a place where people can access the vaccines. So this means that we've gone out to places where vaccinations were never happening before. Apart from polio campaigns, we didn't have house-to-house vaccination campaigns. And yet we've seen that in quite a number of countries.
And then finally, I think we have to find a way to share learnings, because there are pockets of success. And we've heard some stories here today. There are pockets of success, community by community, country by country. We've got to find a way to share those learnings with peers.